Welcome to the Working Smarter podcast. Concise conversations about legal and regulatory topics in healthcare that are always engaging and sometimes funny, with the goal of helping you work smarter.
Hi, welcome to Working Smarter. I'm Wendy Rubas, General Counsel of VillageMD. Today, I'm so thrilled to be joined by two of my absolutely favorite people. We have Cris Lopez, the VillageMD Vice President of Diversity, Equity, and Inclusion. Welcome, Cris.
Thank you, Wendy.
So glad to have you here. And our old friend, Gary Jacobs, Executive Director of VMD Center for Public Policy. Gary, thank you for joining us today.
Oh, my pleasure, Wendy. Thank you for having me. And I just would like to make one comment about my avatar, Wendy.
Okay.
I think it's time to get a new avatar. He got a little older. I got a little older.
Okay.
I think we should change him.
Yeah, I do love the avatars. Although I will say that the team here at Village is telling me that we need to move on and get on video. So in our future episodes, we may try out the video. We'll see. So, but we'll get you a new avatar, Gary. Younger every day. Younger every day. So today we're going to talk a little bit about, this is just professionally fascinating to me as a healthcare lawyer for longer than I want to mention. We've always had anti-discrimination laws, obviously in healthcare. We've had those apply to the environment, known as the ADA. When we build new spaces, they have to be accessible. We've always had laws about, declining care in healthcare. But really in the last, let's say, year or two, this is a major change where for the first time ever, we're seeing a regulatory focus. Now, not that it always hasn't been an objective, a goal, but we're seeing from a regulatory agency focus on health equity. And I just think it's interesting that we're going to see, this is how major policy changes happen, as I've observed in my career. They start with a framework, they start a study, they collect data, and then they will eventually make requirements and rules. And so if you're not watching now, you'll be disappointed later this will, I believe, lead to requirements and changes. But for now, the first thing that we're seeing is a framework of work that they're doing. And there's the framework that they've put out, and I'm going to describe it, and then I'd love to have the two of you interpret what it means, because only thing I have about this is just what they've put online. There's, I guess, 5 pillars of the framework. The first is basically looking at the data, studying, standardizing data collection. So that's basically we have these Z codes and other things they're going to start to require. And ultimately, those will probably be required. But for now, they're standardizing those and analyzing them. And then priority 2 is really do the work. So figure out what causes the lack of equity and address it through policy and other changes. Then priority 3 is around training the workforce, building capacity within the workforce for their work. Priority 4 is really language access, which we've had rules for that. Podcast listeners know we've done a podcast on the English as a second language or language assistance rules. And then priority 5, again, is one of the more mature areas, which has to do with access to the physical environment. So really 1, 2, and 3 are the new areas. And, it's not that often that you see an entirely new branch grow on a tree. And so this is an exciting and interesting area just as a legal matter to watch for. And I know the two of you are closer to this and in dialogue with CMS. So I'd love to hear you talk about why they made this change and what you see inside these priorities. What do they mean?
So Wendy, in the Biden administration's call to prioritization of things coming into its first year, health equity and reducing disparities in underserved communities was a priority. And we knew about that and wanted to see this happen in the communities we were working in. What's unique to Village was that Mayor Turner, Sylvester Turner in Houston, had come up with a model called Complete Communities that really was trying to lift up communities within Houston that were lacking educational, financial, and health support in so many ways. So it's called Complete Communities. And we worked with him on that model to locate some of our Walgreens co-located facilities in underserved communities with the mayor. And that brought us to a conversation with CMMI on the model of ACOs that they were working on that we were engaged with, and said, why don't we put the whole equity disparities issue into ACO context and incorporate it as a critical element of the program? And that's what we did.
Got it. Got it. That's so interesting. So Cris, just turning to you, I know you've had a chance to look at this framework and have had lots of dialogue about it. When you're looking at this, what does this, like, what are you seeing here and what does this mean to you? What should we be thinking about this?
I think you raised this as a topic, and I think it's so important to highlight that part of what CMS is seeking here is for us to re-look at some of the data that we've got, re-look at how we're leveraging that data to truly drive equitable outcomes for individuals. We know that the systems that we've had in place, the really great intent that organizations have had to try to get to health equity outcomes have not actually realized. We're not getting to those solutions. And so it truly is a call to say, let's get accurate data. Let's standardize how we're all looking at it so we can draw some of those insights. And when you look at priority 2, let's look at how at the source those things are happening. So we're helping people truly get to those healthier outcomes by being preventative, by actually being able to address the causes that are driving that inequity in the end, rather than triaging the impacts. And so the focus on data, the focus on understanding the disparities, so we can take action on training and actually creating different patient experiences and outcomes. That new focus really forces us to look at, operationally, how are we functioning and how are we connecting the dots? And that is new. And I think being proactive rather than reactionary is exciting, because to your point before, it's been, once we find the inequity, how do we address it, or how do we report it? It's a change. Yeah.
I love the starting with the data too. I mean, I feel like I sort of quote unquote grew up during the safety movement. Okay. When it was like, we know we have a problem, we have a safety problem. And the data piece wasn't there really. And so there became this common understanding of like, oh, this is what you have to do about safety. And there became these best practices and standards, totally unproven.
Yeah.
And then well-intentioned, right? And mostly by non-physicians that were developing them. And
Right.
so ultimately at the end of 15 years, they study again. It's like, well, it's really not better, even though we've been trying so hard. So I love this idea of really bringing in the data and really assessing before just jumping in, because many times we know things can have an unintended impact.
That's right. That's absolutely right.
Wendy, in that vein, our analytics team has been able to now report to our leadership group on a monthly basis, data broken out by all kinds of cohorts, including African American, Hispanic, Latinx, all kinds of categories that we weren't able to do before or considered doing before. So we're actually bringing the data into actionable bite-sized pieces, if you will.
It's such an interesting point, Gary. And I know VillageMD, we are doing that. I've seen some of the work they're doing, which is so incredible. And this is another change. And just for like someone like me, you remember how it used to be like, fill in your race, or one option was prefer not to say. Like there was always sort of like this taboo, like you wouldn't want to present data and show it by race, right? You wouldn't want to show something by sort of like this idea of equality, or like you don't even really want to probe and ask. Well, the new thinking is no, let's get that so we can look in a more granular way at the impact by these different things. And it's still a little jarring to me, is like, we're doing this at Village in a number of ways. We do, we look at our employee makeup, we do things with our patients and things. But Cris, I think that is a change, right? In terms of our understanding of how to do this.
Yeah, no, absolutely. I think being able to be objective is one of those easy say, hard do things. But it does require going back to basics and going back to our roots. I think one of the analogies I've used for a long time around understanding what we can measure and ultimately understanding if we have inclusive and equitable spaces is that there's a finite amount of things that we can easily measure and leverage to understand how the system is working. I've always used the analogy of when you go in for an annual exam at the doctor, they're not exploring every single organ to check that every single one of them is working. There's a few measures that we take to understand if the ecosystem of your health is healthy.
Yes.
And if you have a fever, it's not just a fever issue. We need to dig in to understand what's behind it. And so this speaks to the approach that we're taking when it comes to our
So
patients.
an
When it
annual
comes
wellness
to
visit, it's like a soil sample. Then you take the results and drill further as needed.
That's right. That's right.
Yeah.
But you need to have had all the data, right? All the history, the knowledge, to understand what are you seeing, what questions are we asking, and then are we drawing the right conclusions? Because I think systems are built ultimately by people, AI, and all these great tools that we've got, in the end are put together by people. And it's what questions are we asking? What are we solving for? And probably one of my favorite things about Village is the way in which we really poke at the system to make sure, like, is the machine that we're building, is the algorithm, is the science, are the insights giving us ultimately the result? And if they're not, we're unafraid to go back and ask the questions to make sure that it is. And that continuous cycle, that continual process applied to health, applied to talent, applied to inclusion in our workplace, that's what we need to shift to if we really want to get to solutions.
So good. So when I look at this priority two, this is assess the causes within the programs and address inequities. What work area? I know you mentioned a program in Houston. I know you've been involved with the ACO Reach. What work do you guys see and you've spent some time with CMS. What are they doing here under priority two in terms of developing or revising programs?
So they didn't want to just throw in some arbitrary language about using the ACO Reach platform to spur interest into diversity and bringing more equality into healthcare in general, Wendy.
Yeah.
What really was happening here was an undercurrent that said we have to do something about identification of the problem and then really have solutions for the problem. And that's why when we're talking about this subject in the context of what CMS and CMMI and Health and Human Services are talking about, they're really talking about if you're an alternative payment model like an ACO and you're going into an underserved community by criteria as established by, in this case, the Area Deprivation Index, which is a index developed out of the University of Wisconsin. It's You have to do something about it. So if we're serving greater Dallas, Fort Worth area, we also have to go into the communities, identify the underserved areas per the Area Deprivation Index, and actually have solutions to bring better equality and deal with the disparities identified in those communities.
I see.
Pretty radical move.
Yeah. So they're just really opening up the door to people bringing in approaches and things. Is that kind of what they're doing?
Yeah, and how should we do it? Is it transportation? Is it a food desert?
Yeah.
Is it a pharmacy desert? How do you upgrade the overall community and the level of care?
Yeah. So it's kind of like a wide open aperture at this point. We're not really sure where they're going to see progress, but it may be outside of the clinic four walls.
Might be the social determinants of care.
So, where do you guys see in your discussions with CMS and in your experience, where do you see them taking this? What can we expect to be coming next on this?
Well, the first thing that we'll be doing is self-reported data on demographics and individuals. So people will report on their own um, who they are, what their history is, what their backgrounds are, and they'll be defining themselves in the context of who they are to us as their healthcare providers.
So we're going to start doing that with our patients, or CMS is going to require that.
That's a requirement
Okay,
beginning in 23.
got it.
So in January 23, we're already set up for it. Chris has been working with our ACO Reach team and making sure that we're doing is in the most culturally appropriate way we can.
Yeah, got it. So that's really going to help with this data collection and study. Anything else that you guys see around the horizon or as a result of the work they've done so far?
Hopefully better care in those communities is the outcome, right? That the
Right.
longitudinal, integrated, coordinated care that we deliver every day at Village is now applied to any model of care that is serving a population. Because, as you know, Wendy, we believe so much in the concept of primary care for all Americans. Well, some
Yeah.
Americans don't get the same care as other Americans, and we would like to stop that in our vision of going forward and provide care to through all payers and to all populations that level of care that we provide today.
So I know, Chris, the work at Village that we've been doing and it's building, and you're helping organize and coordinate that. I'm sure the CMS framework has influenced our work. Do you want to just talk a little bit about how we're approaching the health equity framework inside of our organization?
Absolutely. I think one of the reasons I came to Village, and one of the things that I know our employees are most engaged by, is that as an organization, we're really looking to transform healthcare so we can drive healthier outcomes for all. So at our core, health equity was kind of built into the mission and the who we are. And we really approach the work around driving the achievement and the access to these better health outcomes across the organization, starting with our own employees, our workplace, and our workforce with our organization, extending to the way in which we create this model of care, the integrated approach that Gary mentioned, how we deliver care, so how we actually engage with our patients to build trust, to create relationship and be able to be proactive about our health, and understanding that all of that happens in an ecosystem of factors that impact our health. The actual healthcare component is just one aspect of us being able to be healthy. So understanding how that's connected to our environment, how that's connected to social determinants and drivers of health, really understanding how we impact across those four levels to drive healthier outcomes. And so that model has been in place for Village, even ahead of some of the framing and the priorities that Gary was highlighting in that evolution, but they're very much so aligned to what we're seeing across the industry. And it's exciting that we're seeing kind of the industry catch up in some sense into the way we really approach this work.
Awesome. It's just so important, and already, Chris, just in the time I've had the opportunity to work with you, I'm so thrilled and excited to have your expertise and really guidance on this. I think I can speak for the organization is that we've been working on this. It's not new, but we haven't had a leader to really, with the expertise that you have, to help us frame it and really move it forward. So it's just so great. And I know we're all very excited.
Thank you, Wendy. I appreciate that.
And just to have CMS in the lead of putting out their framework, it really opens up a lot of conversation and pathway. And I hope CMS listens to our podcast, and I want to thank them for their work that they're doing on this too. So it's so great to have both of you. I think we're going to see this evolve in the next year or 2 years and beyond. And I hope you'll come back and talk to us as things change and as things mature and we get more clarity as to what they're finding.
I would love that.
Wendy, what I think is so exciting about having Cris on board is that the framework that she'll talk about is actually moving from our corporate level to our practice level to our patient level. So the stretch that CMS is asking us to make isn't as a big stretch as you might think, because we're integrating it in our organization every day now.
Good. Well, thank you both very much, and we'll talk again sometime soon.
Okay, bye-bye.
Thank you so much.
Thanks for listening to the Working Smarter podcast. Be sure to subscribe wherever you heard this podcast so you never miss an episode. If you enjoyed today's episode, please leave a rating and a review. We'll see you next time.